and welcome to Recalibrating with me, Sharee Johnson, where you'll hear healthcare professionals and others sharing their stories of recalibrating life when the unexpected happened. As a psychologist and a coach, I've been listening deeply to people's stories for 35 years, and I've come to believe two things about people. The first is having witnessed so many incredible stories of hope, adaptability, and human capacity, I truly believe that we are all capable of so much more than we really think we are. In times of challenge, humans have demonstrated that over and over again. Here on the Recalibrating podcast, you'll get to hear amazing stories of healthcare professionals and others pivoting, overcoming, and recalibrating their lives. The second thing that the research and my experiences as a psychologist have shown me is that humans need each other. We need people. When we have support around us, when we tell each other our stories, when we connect through the reality of living our lives, we do so much better than when we pull back and hide what's really going on for us. Together on this podcast, we're going to unearth and amplify what helps us as humans individually and collectively to recalibrate in ways that help us change, grow, adapt, even surprise ourselves when life throws us a curveball. This podcast offers you the chance to be inspired and encouraged to meet the unexpected in your life with grace, skills, and a belief in your own human capacity. Life is full of opportunities to recalibrate with agency, the right mindset, the right resources, and the right community. Today's storyteller is Dr. Rob Blum. Rob works as a medical oncologist. He graduated from the University of Melbourne in 1992 and did his initial physician training in Melbourne at the Austin Hospital, followed on by oncology training at both St Vincent's and Peter Mac Cancer Centre, where he undertook his fellowship. In 2023, Rob was appointed the Clinical Director of Oncology at Bendigo Health, and he's led the cancer service in Bendigo since then. He's also served as the Clinical Director for the Loddon Mallee Integrated Cancer Service and contributed to multiple Department of Health programs, including he was a member of the Clinical Council for Safer Care Victoria for a number of years. Since 2022, Rob has been a member of our Recalibrate community of doctors, deepening his commitment to staff wellbeing. He has also completed professional resilience training with Kath McEwen, the terrific program Resilience at Work. He's completed 12 months training with Leadership Victoria and is currently undertaking his professional coaching training with the Institute of Executive Coaching and Leadership. Rob has initiated a number of programs for wellbeing at the Cancer Centre in Bendigo, including inviting the staff to assess their own professional resilience using the Wellbeing Index and making the Wellbeing Index a part of the standard operating procedures in the Cancer Centre in Bendigo. Rob's current focus on sabbatical is to learn how the pro-social framework can be fostered in the Cancer Centre at Bendigo Health. Outside of medicine, Rob enjoys weight training. He's an active musician, which you'll hear us talk about. He performs on the cello, the piano, and with his voice in the local string orchestra, choir, and theatre company. Rob is married. He has 2 adult children, and I can vouch for this, is always curious about new ideas and better ways of working and living. So I'm really very chuffed today to invite Dr. Rob Blum to share some of his story with you here on Recalibrating with Sharee Johnson. Hello, Rob. Lovely to see you.
Hi, how are you?
I'm well, thank you. Thanks for joining me here today on Recalibrating with Sharee Johnson. So let's kick off with where your work is at right now. So you're the medical director at the Cancer Centre in Bendigo, which means you have an administrative role and a clinical role. Can you just paint a picture, tell us a bit about what work looks like for you at the moment?
Sure. Okay. So I'm the as you said, the clinical director of cancer services at Bendigo Health. So we have a cancer centre. I live in Bendigo, which has a population of just over 100,000, but it drains about 350. So it's a relatively busy unit. Where people come to be treated for their cancer, where they have the chemotherapy, radiotherapy, clinical trials.
Mhm.
and all of the supports that go along with that. So we've got a group of approximately 70 staff called clinicians, in addition to additional staff as well. So it's pretty busy. My day, as you alluded to, consists of both administration, so overseeing the direction of things. I work alongside Chris White, who's the director of the Cancer Centre.
Mhm.
Of course, there are leads in all of our craft groups, but then I've got a pretty large component of work that is seeing patients. And I'd have to say it's probably about 80% of it is still clinical. So I have a significant clinical load. Plus, I have to look at some of these other components of the way that the unit operates. And I suppose, what we are constantly doing is looking for improvement, looking for innovation, and growing the service because the population is increasing. And as the unit becomes more self-sufficient, we get more people who would historically have gone to Melbourne come and be treated locally.
Mm. And obviously, you didn't just land here out of the sky. You've been on a long journey from school through medical school and through your specialty training and so on. Now you're training and supervising other oncologists. So, can you just walk us through for a few minutes that story, the significant steps that might have shaped you and helped you get to where you are?
Sure. Okay. So I grew up in Melbourne. So I grew up in St Albans, which is one of the western suburbs for people that working class area. Neither of my parents were professional; both were European from overseas. So came from a good grounding, but work ethics was important because that people were, particularly the new migrants were, tempted to make a new life and to work hard. So that was a good basis for my own personal work ethics. And then went to multiple schools. Eventually went to Melbourne High, which was an academic school, a selective school, and then ended up doing medicine. Realistically, had no idea what that actually was. So I didn't have any personal experience with it. It was more of a concept. And I think that in some respects that was helpful in some ways because I didn't have an expectation of what it looked like. And then eventually decided that I would do physician training. And my first experience with cancer actually was at the Austin Hospital as a resident. And I knew immediately that that's what I wanted to do because what I loved about the work was that it was very much team based. So, all the components, the allied health, the nursing staff, the other doctors, they all had an equal and important part. And I loved the fact that you would work together and support each other. I've also found that obviously the medicine very interesting. Patients were often very grateful for the work, for the treatment that they received, and it was very gratifying. And also, I think it's big. It's really a boom area of things are changing so rapidly, so it's never boring.
Mm.
And In terms of my ending up in Bendigo, that was really serendipity. It wasn't a plan. So I was at Peter Mac. I was doing my fellowship there, and essentially their primary oncologist decided to move interstate, and so they didn't have a replacement. So Peter Mac, as an organisation, provided an outreach service in the interim, and I thought it would be a good opportunity to see some sort of more uh, common stuff. I was seeing a lot of rarer things at Quaternary Hospital. So I want to see some of the common variety cancer treatments and patients. And so as a result of that, I said, can I come along to these clinics too? So that's how I ended up there. The truth be told, I was going to go with a clinician of a friend of mine. And at the 11th hour, they got another job. So I ended up going to Bendigo Health as a sole clinician, which is exactly what I didn't want to do. I was 34 years of age, but I felt like I'd made a commitment. And I was married at that stage with young children, and we decided Kate and I, who's my wife, decided that we would give it a shot and see what it was like, knowing that we had choices and that if it wasn't going to work, we would make other decisions. So starting off there as a single oncologist, and just to give you some perspective, we now have about nine.
Mm.
It was pretty scary.
Mm. Yeah.
Um,
And when you made that move, you didn't buy a house or something. You moved with, your options open to be able to fairly easily go back to Melbourne, or how?
Absolutely. Yeah, no. I mean, again, having European working class parents, you don't make a decision you don't have to.
Yeah.
So we kept our house in Melbourne, and in fact we still have it, and we rented just to get a sort of a lie of the land and see what it was like. But, to be honest with you, the reason I contemplated going there was again the team. So, what struck me was that when I met with the team that existed, which is obviously was a lot smaller than it is now, I love their can-do attitude. If we needed to do something, they just said, "We'll find a way." They were again very innovative and nimble, and they had to be because they had a lot less resources, and it was also their community. So again, I love that concept of the team. And it was for that reason I thought that I actually contemplated doing it because it was reminiscent of an experience that I had when I first started my oncology training, which was at St. Vincent's, and I had the same experience. I can remember the her name was Anne Cook. She was like a senior, the nurse unit manager, and I can remember my first day. She said, "Welcome. If there's anything that we can help you with, just call out and we'll be there to support you." And I felt immediately at home.
Mm.
So again, it was something that drew me to the Bendigo unit. That I thought, I think I can work and live here because it is like it's another home, right?
Mm.
For me at least, it's not something that I just go to at certain times. It's another place that is my home environment. So it has to feel right.
Mm. I'm interested, Robin, you're talking about your family and Kate, and like they also had to do some recalibrating, didn't they? So what are the important things about, are there differences in how you have to how you go about this recalibrating when you're doing it with another group of people, in this case your family, or when you're just deciding to yourself, well, I'll go to this hospital, and I'm also interested in this story, in that experience of team is so important and so appealing and so much a part of it for you, and then you arrive and you're a solo practitioner, although you're pointing now to you did have some colleagues, nurses and others.
Yeah. So to your first question, I mean, I sort of feel like, the concept of the recalibrate and the skill sets, I mean, the universal, it doesn't matter what challenges, where
Mm.
the challenges lie, whether it's at home or at work. I feel it's the same.
Mm.
I think probably the differences are that for your family, there's always the risk, I think, and I feel like this does happen particularly in the medical field that um, because of the pressures of work and because of where you work, you sometimes can take for granted your family.
Mm.
And there's a real risk in that. So I think the difference is that your family is your family, and I've certainly been guilty of that myself. That sometimes you can sacrifice your family for your work, um, but at the end of the day, it is still work, and your families, I think, should take priority. But we don't always do that, right? We think they'll always be there till
Mm.
they're not. So I think that's probably the only distinction I would make. But the skill sets, I think, are the same. That's my
Mm.
interpretation of it.
Mm. Can you name a couple of those skills? What do you think are important?
Oh, I think, one of the things for me is this concept of the being mindful of what's going on. And I think for some people they think, well, that's just when you do some relaxation and deep breathing. But what it is it's the gap between an experience and a response to it.
Mm.
So, and I think think about as being aware of how your environment, the situation is making you feel, having the space to acknowledge that I'm feeling angry, scared, joyous, whatever, and then thinking about, okay, right, well, how am I going to react to that? I think, often the thing for me that's what probably most impactful was that until I spent some time looking at these things, it was pretty much brainstem stuff.
Mm.
And the problem with that is that sometimes when you do the brain stem stuff, and it's something that is high stakes or high emotions, you can be down the track somewhere, and then you think, how am I going to get out of this? I've gone too far, I've said too much, I've done too much, and now I'm going to have to backpedal a lot. Whereas having that capacity to just take a couple of seconds and think, nah, that's actually going to be really dumb saying that. I might do it a different way. I've actually found that really helpful personally because, again, I'm blaming my European genetics here that, we're often very emotional and reactive to stuff. And, particularly when you're in positions where you have to lead people, um, it's probably not the best way to operate most of the time.
Yeah, and so for people who don't understand the lingo, I think that brainstem reference is that reactive hot brain.
It just happens. It just comes out. That's one of the things that I've got out of the recalibrate stuff, or the process of doing it. I think for me, the other important components of it have been the concept of looking after yourself, and that's, I mean, that, you hear about that all the time, um, but about prioritizing what do you need to fill your bucket so that you can do the work. And I think probably in the past, again, coming from the background that I've got, the concept of self-sacrifice, in order to get through university and get your exams, that sort of stuff, where you do have to do a lot of delayed gratification. But when you get to the end, if you don't change up what you're doing, it starts to become deleterious to you. And I can't remember the book, you probably can help me, but it was a palliative care physician who talked about having those characteristics that might initially be beneficial to you in terms of, they're the characters that allow you to end up excelling at school, getting your high ATAR, or in my case, HSE, and then getting to university and passing all the exams. But then if you keep on using that self-deprivation stuff, it starts to be deleterious to you. That's when you start to sacrifice your family. That's when you start to sacrifice your health. And I think for me, while I've been always pretty aware of like health, but it became more evident as I get closer to death that you got to work hard to keep yourself well.
Mm.
But also, you have to start drawing some lines and saying, well, actually, I'm not going to go to that meeting at 8, at 7 o'clock, because that's when I go to the gym, and that's actually really important to me. And that's going to allow me to do the rest of the day. And so I used to see those things as being extras, but now I think, well, those things are actually essential,
Mm.
and you can't do it all. So I'm going to cut some stuff out that I might have once felt obliged to, but now I can say, no, nah, not doing that.
Do you think that priority setting and that deciding what's core and what's extra is different through the phases of your career or through
Oh,
your ages?
totally. I mean, I think yeah, I'll qualify that. I feel that it definitely is, because it comes from, I suppose, as you get more comfortable with who you are, and also realistically have a track record, then the power position is different. I think when you start your career, that's very hard to do. And again, you know, I you know, I'm 57 years of age. So when I started, a lot of this concept of well-being, I mean, that just didn't exist. And you would never question the hours you got. You didn't have afternoons off, I can tell you that. So
Mm.
that wasn't even part of the vernacular to be even thinking about this, right? So, I feel like I've gone through some stages. I mean, the things that we had to do is now illegal. Being on call for 4 days consecutively, 24 hours a day, that just doesn't happen anymore, for good reason. But I think also it's a little bit like, as you get older, you start to think, well, you know what? I'm pretty comfortable with that decision. If you don't like that, um, then maybe you need to make another decision about it. So I feel like generational, and I feel like I sound like an old person now, but I feel like the generational thing is changing, though, because I know, that even when we look at our rosters for, younger doctors, the hospital administrators actually are quite strict about, the number of hours and, having their time off and, educational time and that sort of stuff, which I think is a good thing. And I don't know, I feel maybe, again, from a generational perspective, that may be changing, but I mean, that's just my opinion.
Well, I think yes, it's your opinion, but we also need to recognize the evidence. If we want to talk about being evidence-based, there is evidence that working in those ways was not helpful for doctor decision making. Let's just pick on that one. I mean, it wasn't helpful in lots of ways, but we know now that working on call for days and days and days in a row, or not having sleep, or having interrupted sleep, has significant impact on a person's capacity to relate to other people, to make decisions, and to not make errors. So, I guess there's science behind that, as well as just people saying, I don't like my life looking like this. And I want to pick up, you talked about, the importance of track record. And I think that's really reassuring for any younger doctors that might listen to this, because I often hear that in coaching, that younger doctors are saying yes to everything because they feel like that builds their network, which I think it does. And it gets some credit in the bank. It gets some more things on their CV. So it's a really careful balance, isn't it? And it's kind of lovely hearing you say that you can be finished with some of that now and be letting go of some things. What does that feel like? Has that been a bit of a mental shift or a mind shift to get to that place?
Totally. I mean, it's interesting because, again, putting this into context. So as I said, I've worked with, well, 9 other oncologists, who, and including also some hematologists as well. I think we've got 4 at the present moment. But many of the junior consultants I would consider to be very capable, very bright, charismatic, and as a colleague, it can feel a bit threatening. But again, when it comes to things like, good leadership, it's like, well, this is their time, and you can let go of some of those opportunities that you might have once been in the spotlight,
Mm.
because it is the natural progression of things. And they, the people that are coming up have got, different skill sets, different experiences, different ideas. And if you're a good leader, you should be bringing them along and allowing them to thrive, right? So again, it's one of those giving up stuff,
Mm.
which, as you progress through your career, that's what should happen. And I think sometimes when people don't give up some of that stuff, then it's not just deleterious to them, but sometimes it's deleterious to people around them, because, the world is always changing.
Totally. So this notion of recalibrating or adapting or adjusting, it requires adding, picking up, but also it requires letting down and putting things, finishing things, or moving away from things. And that, that can be fear inducing for people, that what if I want to pick it up again, or what if I miss it, or what if I want to come back to it? Can you cast your mind forward to, you're talking about this phase of your career, to the retirement kind of decisions and those processes? What comes up for you thinking about that?
Well, I think one of the things that, and I've seen it happen in the past, there are some people who their career is everything,
Mm,
right? In order to get to the heights that they've achieved, they have sacrificed relationships, families, those sorts of things. Um, it's difficult, isn't it? Because these people will potentially generate amazing research or do amazing things, and if they didn't, well, then someone else might not do that. But that's a choice that you need to make.
mm,
But for me personally, I would consider myself a bit greedy, in the sense that I like to do a lot of things that are outside of work.
mm,
And the concept of transitioning is not so not I'm not afraid of it. I feel it's just a natural progression that everybody has to do, and I do have other things to look forward to that I currently do that
mm,
I'd like to give more space. So for me, it's just It's just a natural process. I think that people who are fearful of it are often because they have nothing else. So they
Mm,
think, if I
mm,
don't do this, what am I going to do? So I feel like
mm,
that's comes back to that previous point we made about the fact that you've got to have other things in your
mm,
life that fill your buckets and give
mm,
you energy and sustenance. And it's also a good security. It's a bit like, you don't put all your investments in one basket.
mm. You're really touching on Nassim Nicholas Taleb's idea of anti-fragility. I don't know if you know that idea, but he says that the opposite of fragile is anti-fragile, and that there isn't really an English word that's the opposite of fragile. I was thinking about robust, and he says, well, robust doesn't, it's neutral. Something can happen to something that's robust, it stays the same. But something that's anti-fragile doesn't break and it grows. It's better for the stress. It develops from the stress. And one of the things that makes people anti-fragile is having options, which is what you're speaking to, this idea that when we have options, we can flex and adapt and adjust and feel like that's okay. I'll put my energy or my time over here. Um, and fragility is very much a part of perfectionism or procrastination, that I've got to protect myself and defend and manage the risks. Whereas anti-fragile is, well, I can handle the risk. I've got confidence in myself. I've got options,
Mm.
which I think is lovely. You've given a lovely kind of reflection on that. You've supervised and mentored a lot of young doctors at this stage of your career. If you could, kind of give them something, words of wisdom, about this idea of this continual change, this continual recalibrating that goes on through not just a medical career, through life. Have you got a gem or two that you would want to offer them?
I think one of the important things about life work in general is having a really good idea of self.
Mm,
So what am I about? What are my values? What's important to me? Because I think if you're clear about that, then when you have to deal with important decisions, you can reference that and say, does this fit with with what I envisage is important to me? I think that's something that's really important, because again, if we think about the medical profession, and it probably applies to many other careers, there's a strong sense of what a doctor looks like.
mm,
What they dress like, what they sound like, and it's not true,
mm,
but there can be a strong sense that people will form themselves to emulate that, so that they have their Iron William boots and that sort of stuff. I don't own a pair, just to let you know. But anyway,
Thank goodness for that.
but it's like, you know yourself that when you meet someone who's true to themselves, it's like a breath of fresh air. And actually, that experience comes across to the patient as well. So, I mean, of course, you've got to be mindful of the environment that you're in. So you can't be completely, you have to have some concept of what's appropriate for the space. But nonetheless, that being genuine and true, I think that's really important. When you have to maintain a facade,
Mm,
you make choices that you don't necessarily want to do. And if you've got to make those decisions, you have to ask yourself the question, is that what I really want? It might be, but I
mm,
think doing it in a conscious way is far better. I know for me, I think about it, like I sort of trained in Melbourne. I was at the Austin, St. Vincent's, Peter Mac. They're all academic centres, right? So for me to think about moving to the country or a regional centre at that stage, which is different now, I feel, was not a common choice. There were some people, some pioneers that did it, clearly, and thank goodness for that. But
mm,
it wasn't the most popular decision. And on reflection, I think I've had so many more opportunities to do stuff, in terms of working with government and looking at regional issues, and obviously within the hospital itself. So, and again, even from a personal perspective, I mean, the lifestyle, I always, yeah, people talk about the lifestyle. What is the lifestyle? And my definition of the lifestyle is time. So, I travel 4 minutes to work, 4 minutes back. And if you have no time, you have no lifestyle. So, proximity to everything has made a significant difference in terms of what I can do. So I think that's probably an important thing to do, is to think about what are your core values, and make reference to that when you're making important decisions. And I think probably the other thing that, again, can be challenging, but getting someone that you relate to as a supervisor, or someone that can mentor you, I think is important, because one of the other challenges that we all have is that we deal with adversity or challenges, and having someone that you can safely be honest with and bounce ideas off, I think, is really helpful.
Mm.
Because again, it is a competitive market. You do have to be a little bit cautious about, what decisions you're going to make and how it's going to be interpreted. And, to be honest with you, not everyone in the field is necessarily supportive or conscious of, some of these things that we're talking about. So, which is unfortunate, but it's a reality. So I think having someone that you can bounce ideas off, or have a support network, I think is really important, because it'll help you make better informed decisions.
Mm. Yeah, so we've got know your values or know yourself, and have some anchors in that regard. Think about your lifestyle in relation to that too. Like, what is it that you want to be spending your energy and time
Yeah.
on? And having somebody that you can trust, who will call you out, but also who will support you, and have an honest, frank conversation with. And that person might be in medicine, or they might be outside. Maybe for different issues, you might
Yeah.
need different people. Yeah.
Probably the only other thing I'd also say is think broadly.
Mm,
So again, if I think again about my own personal experience, it's, when you first get into the system, at least from what I saw, it's very narrow.
mm,
Like, the concept of what success looks like is very narrow. It's like you do, your training, whether it's, general practice or, specialty training. Ideally, if you're really successful, you become an academic and you publish and you present. And if you're really smart, you'll head a research unit, for example. And, I mean, that can be true for some people, but I remember when I was doing some research, you know, uh, through my training, and it was probably, to be honest with you, partly what I was researching on rather than the research itself. But I didn't feel the passion, and it's different if you're doing it for a period of time and then you stop it. But if you're going to be doing something, you know, for the rest of your life, potentially, you got to love it,
mm,
or at least like it.
mm,
And so I think that that's also important. And so, I've met people along the way that have done stuff that I didn't even know existed. You know what I mean? And the other thing about a career is that what I realized once, when I was actually was at a work, sort of a work, uh, with a brainstorm thing, where they had an engineer that was employed within the hospital, not structurally, but because of the way that their brain worked, that they approached problems in a different way. And I thought, well, actually, you have skill sets when you train to do a particular career, and you use that process to really look at probably lots of things, not just medical ones. But you could use that medical experience in things that are not patient based,
mm,
or it's extremely broad. So that's probably the other thing too, is that it's always important to question, because
mm,
um, you know eh, there are broader things sometimes than what is being presented to you. And take courage in looking at those things, even if it's not the most popular thing, it might be right for you.
mm. Yeah, you're taking me back to an earlier part of our conversation when you were going to Bendigo and you found out that your colleague wasn't coming. Did you rethink? Did you consider Not going? What was the recalibrating that happened then?
Yeah, no, I took about 3 days to think about it because I was literally petrified because it was everything I didn't want to do. I
Mm,
would be potentially professionally isolated. I had just finished my training. I'd never done any form of, well, you often don't training in managing other people
mm,
in that sort of sense. And also I'd never lived for an extended period of time outside of Melbourne. So I was thinking, what does this mean for my family? What would the education be like? And I can distinctly remember I couldn't find AB's classic FM, and I thought, I can't believe this. They don't have. It's like it's actually just down there. It's down there. It's back down it's always another number. It was
different
not.
number, yeah.
Yes,
And what helped you stay? What were the things that led to you? What was the decision-making process? Not so much the factors, but what was
yeah.
the process to decide to stay?
I think what I did was, I mean, obviously I spoke to Kate about it, and we sat down and literally looked at the pros and the cons. And I think for me, the ultimate thing was, there are very few choices you can't reverse.
Mm,
There are some,
mm,
but there aren't many.
yeah.
And so again, I suppose if you hold fast and think about that, I think it's sometimes I think the fear can paralyze you. And for me, I mean, I really have absolutely no regrets at all. I think it was the right choice, but it
Mm,
was scary at the time. But again, I don't know. My personal belief is that I try not to shy away from things that I find scary.
mm,
And I suppose that's probably the other thing too that again, it's been reinforced by some of the recalibrates, that concept of leaning into stuff rather than, leaning away from things.
yeah. I love. I think I can hear the adventurer's heart in the story. Something about when you go on an adventure, there are obstacles. It's different to just traveling along a road.
Hmm.
It's an adventure. There are unknown things. There are obstacles that we'll have to navigate, and we're not sure. There's an uncertainty in that journey. That's what I can hear in that story, the
Yeah.
adventurer's heart, that the willingness to take a bit of a risk and to find out.
But I think realistically, I mean, we do that all the time. Everything we do has a risk or an unknown component to it. I mean, if you think that that's not the case, I think that's delusional.
Mm.
But also, you can't do great things if you don't take risks.
Mm, awesome. So let's move our focus a little bit. So you've just alluded or just talked about classic FM. You're a musician. You play the cello and the piano, and probably other things that I don't know about. Um, you sing in a choir, and you're recently treading the boards in an amateur theatre production. I can't wait to come and see it. So tell us about that. You have prioritized these non-medical things, these other activities. I think you said that you were greedy about it before.
Yep.
What's the balancing act that's required to hold a leadership position in medicine, have a lot of responsibilities, have 80% of your time at work, clinical, so lots of patients also who are relying on you or looking to you. What's that balancing act like?
Um, so I think one of the first things is get rid of perfectionism.
Mhm.
So, if I wanted to do everything to the level that I would like to do, I'd need more than 24 hours in the day or not have to sleep. But I feel like, there have been times when I've, for example, literally just practiced the cello, once or twice a week for 30 minutes and still gone from a lesson. But I think if I stop doing that, it'll just disappear completely. So I think giving it some sort of priority, you might not be able to do it exactly the way that you want to do it, but doing it some of the time is better than none at all. And I have to say that when it comes to physical fitness and all that sort of stuff, it's non-negotiable pretty much because I feel like that's going to help with my mental well-being and my, decreasing frailty and all that sort of stuff. So, but I try to do it as best I can, but I make sure I do some of it if not all of it the way that I'd like to. Because it has been something I've done since I was 6 years of age, and in fact, when I was in a VCE HSE, which was Form 6 then, which is now Year 12. I was actually going to go to the con. That was what I was going to do. And then I did a flip at the end.
Mm.
So it's always been a big part of my life. And again, to be honest with you, I try to sort of modify stuff or move things around if I can. But as part of my passion for music, we've got a grand piano in the cancer centre where we get musicians to come and play for our patients. But I'll be honest with you, part of it was motivated by the fact that I could access the keyboard occasionally at
And
work.
so, how often do you actually play it at work?
I don't play that often. I play it probably every, I don't know, maybe a couple of months. I'm on sabbatical at the moment, so I'll probably do more of that. But it is interesting because even that, it's been used by other staff. Sometimes they'll come at the end of the day just to unwind. So it's got all those benefits, for everybody. So
Yeah.
um,
I think the Hush Foundation, or maybe some others were involved, had a program of bringing pianos into hospitals. I think that in Australia, at least, they might have been involved in a lot of hospitals getting pianos. I can't remember what that. Do you know what that scheme was?
not sure.
Mm. Yeah. So, what's again, another story of demonstrating your value and also a habit. I think that you had a habit since you were a small child of playing music, that you haven't been prepared to let go. You haven't been prepared to let the other things that have come into your life push it out, which doctors often do say that, I used to play the violin, I used to run in triathlons, I used to whatever. And, there was no time for that during my exams and it's never been reinstated. I've never got it back in. Any reflections that might be helpful in that space for other people, or even just commentary about what it brings to your life to have kept those the exercise and the music in the mix?
Yeah. I mean, I think the first thing that comes to mind is I always say this, you only have so many heartbeats.
Mm.
So, and that's partly how I value what you do. Sometimes you can be in a meeting for three hours and you go, I'm never going to get those heartbeats back. That was not worth
Mm.
it. So I think, that concept of we've got limited time, is this what I want to be doing? And so for music, the answer is absolutely yes. And I want to do more of it,
Mm.
if I could. And I feel like that concept of missed opportunity. At the end of the road, I want to be able to think, I've squeezed every ounce of opportunity out of the life that I've
Yeah.
lived.
I can't think who says it, but there's somebody that says, if it's a I'm not sure, it's a no, and if I'm doing it, it's got to be a hell yes.
Yeah,
Yeah.
yeah, absolutely. So it is good for you. I mean, it makes, if you sing, there's all the science behind it, but we
Mm.
know that you feel good, you feel better, you feel elated.
Yeah.
I mean, the same experience, maybe not to some degree, is watching somebody else do something, whether you go see a performance, professionally or otherwise, being part of an audience and experiencing that together is also really positive. And whatever that thing is that you get, whether it's, being out, in nature, doing triathlons, knitting, reading books, whatever, there's more to life than work.
Joy. Yeah. Yeah. This thing about joy, it's amazing, beautiful. Um, so we've talked a bit about time and we've talked about energy. Actually, let's go to talk about your bicep. So you had an injury that came from really a normal, ordinary activity you never could have predicted, helping your friend, um, that really threatened your ability, particularly to play the cello.
Mm.
That was a moment of certainly of having to recalibrate your mindset for a while and also your physical body. Can you tell us that story?
Yeah, sure. That was about 2.5 to 3 years ago. Yeah, so a very innocent event, and it wasn't particularly heavy, but helping a friend move an ottoman, and we were going down the stairs, and unfortunately, I was behind and coming down the stairs, and they moved too quickly, so my arm was extended under weight, and literally, I felt the biceps tear off the off the bone, and so got it repaired, but unfortunately they still can't explain it, but following the procedure, I ended up having a radial nerve injury.
Mm.
And so essentially, I couldn't move my wrist properly. I had numbness along the outside of my wrist and hand, and also I lost dexterity in that hand. So, and it happened really quickly, like the wasting. It's phenomenal. It happens within weeks.
Mm.
Fortunately, we got an opinion from a neuroplastic surgeon who diagnosed essentially some narrowings around in the upper part of the arm, and they were released. And he actually said to me, he said, "This is such a rare condition. I've only seen 3 or 4 of them." And I said, "You know, what will happen if you do it? You know, will it make it worse?" He goes, "I don't think so. It might not make it better." I said, "Well, let's do it." So did that, and then had to do intensive gym work and hand physiotherapy. They told me that whatever function I got at 6 months was probably what I was going to get. And I thought, no, I'm not accepting that. So I worked on it for 2 years and pretty much got it all back. But I couldn't play the piano. I could move my fingers, but it sounded really woody. I had no dexterity. I couldn't even play the cello. And so, because this is an important part of my identity of who I am and what I love to do. And I thought, it started to do my head in a bit. I remember I don't journal, but I did actually keep a journal because of what I thought that this process was going to be slow. It would be cathartic, and then I'd be able to look back and say, "Oh, actually, 6 months ago, this is all I could do. Now I can do this. And it might actually sustain me."
Mhm.
But I also thought I can still sing, and bugger it, I'll learn the trumpet because it's just one hand. Seriously, I thought I'm going to give this 12 months, and if I can't, if it's going to be rubbish, I'll just learn the trumpet. So that's what I did, but it was really interesting because I couldn't put on a belt properly. I struggled to put on my underpants, and I think for me, what it made me realize, not just the loss of the musical stuff, but I thought this is what other people face all the time.
Mm.
So for me, it was like, when someone came in and they talked about losing function in for whatever reason, I thought, I get it.
Mm.
So, I mean, again, it's one of those things where you would not choose to do this or have this experience, but it really does change your perception of stuff. And I think the other thing for me, right, it's a bit like any form of grief. Initially, you feel awful and you wake up thinking, oh my God, this is real. It's not a dream. But at some point, it does start to get better. And, I don't know that I don't, I mean, I still remember it. If anything, it's probably just augmented my joy and appreciation for what you have, which again
Mm.
sort of makes sense. But yeah, it's a pretty significant experience to have, and I would imagine it's like any loss. People lose their job or that sort of stuff. You've got to go through that process. But one of my colleagues, Becky Chapman, who's a palliative care consultant, talked about when she went to the dentist, there was a little sort of framed sort of image that said even the darkest hour only has 60 minutes.
That's useful. Try and lock that one in too. Yeah. I
So
mean,
I thought,
it's humbling, isn't it? These experiences are humbling. They
totally.
remind us that we're human.
Oh, absolutely. Like I said, I mean, I'd lost some pretty significant basic function.
Mm.
In fact, I can remember, I had to get my car serviced and I had to travel to Shepparton for that. And I couldn't, I ordered lunch and I couldn't even eat it properly. I sort of thought like, oh, wow, this is, and I thought I just push through it. But, it was interesting, like that sort of level of being
Mm.
self-aware of the fact that you couldn't eat properly.
Mm. Mm. So you made a throwaway comment maybe then of push through it. And that is definitely takes that has its place, this idea of pushing through something that's hard. We know actually that develops some of the parts of our brain that help us do hard stuff again next time. So that's a very valuable capacity to be able to have that awareness that this is hard, but it won't be hard forever, and it's something that's important to me, so keep going. But what else was really important to you in that time of being humbled by your body?
I had to reframe stuff.
Mm.
It's that mental flexibility. It's like, okay, well, this is what I kept on saying to myself, this is what it is today.
Mm.
This
Beautiful.
is not necessarily what it'll be tomorrow or in a week's time, but this is what it is today. And, and if I do have a couple of wins, then, then that's some sort of progress. And
Mm.
then also what I had to be thinking about is also without being, Pollyannish about it, like, okay, we're going to give this a set time. And then if at that point it looks exactly the same, then I'm going to have to mix it up.
Mm. There's
Um,
that options thing again.
yeah, well, it's like, if this is what it looks like, I don't like what this looks like, I'm going to have to make some changes or different choices.
Mm. Mm.
Yeah.
So we've been talking in general about recalibrating. You have referred a couple of times to our Recalibrate program, and I remember so vividly when you and I talked in 2020. It was the first year of the COVID pandemic. You were inquiring about this program that we were offering, and we were in suspension because we were trying to think about, could we do it online? Could we run this program that was really about connection and peer support and developing skills in our interpersonal communication? Could we do it online? As many people were asking those kinds of questions. What can we do online now that we're all in lockdown? And I remember very vividly you saying, I want to experience it myself because I think I'd like to encourage some other people to do it, but I want to know what it is. I want to experience it first. I think this leadership of leaders go first in terms of risk or being courageous or trying something new has a lot of merit. Can you talk to us a little bit about where that's come from in you or what's important to you about that idea?
It's a little bit like if I think about my current situation, in that I'm a clinician and I have managerial responsibilities.
Mm.
There's two things. I feel like, while it might not be true in all instances, you got street cred if you're also doing the work.
Mm.
Like if I'm sitting from a position where I don't do any of that stuff that I'm asking you to do, then it's unless I've done it before, at least, it's very difficult to appreciate what the impact of what that might be.
Mm.
And I always, again, it comes back to my sense of teamwork. I feel like if I roll up my sleeves and I'm beside you, then I feel like, I'm validating what I'm doing because not only am I asking you to do it, but I'm doing it as well and demonstrating. And I think again that is an important part of leadership because kids can pick out a phony really easily, right? So it's like if you're not walking the walk, I think it can be difficult. I mean, it depends on what it is. Like if it's something that's not important, but if you're asking for someone to invest in something significant,
Mm.
then I feel like it is a bit harder to ask someone to do it if you haven't done it
Mm.
before. So it's something that I must admit I tend to sort of take an approach to that. Like we've looked at the role of AI, for example, and in terms of one of the first people to try it, I want to be one of those people because
Mm.
I don't want to request someone else to do something and then find out that I'm making their life more difficult without experiencing it myself and understanding it. So
Mm. So it's not just about kind of the shiny new thing and early adoption. It's about having a deeper understanding and well, literally a lived experience of
yeah,
things. Yeah.
yeah.
Yeah, I think there's something very honourable about that in terms of, particularly in the work that we're talking about, where we're asking people to do self-development work and to be, radically responsible for the choices that they're making. To say, I'm also doing that too. There's a idea in the therapy world and in the coaching world that you can't really bring anybody in those processes in therapy and in coaching. You can't really bring anybody where you haven't been yourself. If you're not willing to feel uncomfortable about some powerful feeling rising up in your body, then how can you expect to sit with somebody else who's doing that?
Mm.
Um, so yeah, I think there's a kind of feels like Mr. Miyagi or something out of Karate Kid that there's something honourable about this process.
Yeah.
So before we wrap up our conversation, Rob, is there any other things that you can think about in your experience about these moments of recalibration where things are going wrong or the world's thrown you a curveball or something happened that wasn't quite to plan, but here it is, this is the reality that you, after this conversation, this reflection, are noticing about that process or those moments that's been of value that you can, spot?
I think the important things are when you're feeling that way, just stop. It's a bit
Mm,
like when you get lost, they tell you don't
mm,
keep walking,
yeah,
sit down and stay
yeah,
still for a minute,
yeah.
and just think about what's going on and why you're feeling that way. Because I feel like, as I sort of alluded to before, there's usually another option.
Mm,
You just have to find it.
mm,
And sometimes what you're thinking is happening is not what's happening, or you're catastrophizing something. So if you're feeling overwhelmed, just stop and breathe.
mm,
And again, if you've got someone who you can bounce ideas off, I think that's also very helpful, because then they can either validate what you're experiencing, or they can say, hmm, that's not my perception. Have you thought about this? Because I feel like, I don't know, there's just a sense of urgency that you've got to, you have to make all these decisions in your career, and you've got to do it quickly, and you've got to do this and you've got to do that. And it's like, well, who says?
mm. Beautiful. Who says?
You
Indeed.
know,
Yeah.
yeah. So sometimes you got to take yourself right out of it. And
Mm,
that's, I think that, again, from a professional perspective, while it was like, working in a regional area, it's different,
mm,
but it's good different.
mm,
But sometimes you got to take yourself out of, a situation where this is all you're seeing, um, and go somewhere else. And sometimes it can be quite different. It can give you the courage to, maybe reevaluate or look at it in a different way.
mm.
So I think that's probably my take home message, is just be still and sit with it and try to work out, let the dust settle, work out what's actually going on. Because sometimes it's in your head.
Well, I think there's nearly always an in the head component, isn't there? So much wisdom. I think, it's a 40-year process that you're up to now, from when you left school to when you've reached your sabbatical that you're on now. And these processes of pausing and reflecting, the medical board says that all doctors must do reflective practice. Lots of times we don't quite know what that means, and life takes us over. I think you've given us some lovely examples today of just pulling up, stopping, and having a bit of a look around and seeing, what else might be true or what else might be possible. And some lovely messages about approaching risk. And, what I think you said earlier, most things are not reversible. So thank you very much for your time today. I really appreciate uh, being in your presence for this last hour or so.
Yeah, it's been a pleasure. Thanks, Sheree.
Well, Dr. Rob Bloom has certainly given us a lot of gems, I think, to hang on to from that conversation. Lean into risk, make sure you have options, or at least remember that you have options, that there are more options than you might think. Have a confidant, or maybe have more than one confidant who you can bounce ideas off. Most things are reversible. I think the other really important story that I loved in Rob's story, and I think we've heard this from Liz Wern last week too, is these other things. Have other things in your life: music, exercise, art, other people perhaps that aren't medical people. That's my thing. Not either of theirs. But have variety in your life. We know that our brains love novelty, and that we do well, we thrive when we have other things going on in our lives. So thank you for joining Dr. Rob Bloom and I today on Recalibrating with Sharee Johnson. I look forward to talking to you next week, and may you be well. The content in this podcast is not intended to constitute or be a substitute for professional medical or psychological advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified healthcare professional. This podcast represents the views of the hosts and guests and do not necessarily reflect those of any entity we work with or for.